All right, everyone, welcome to our webinar today. Let's talk about vaccines. We really appreciate you taking the time today to join us and learn more about vaccines and how it can help you and your loved ones keep protected. Today, the key focus for this talk is on flu and pneumococcal vaccinations, and it's a collaboration between MINDS Caregiver Support Services Center and SATA CommHealth. MINDS has been helping to serve persons with intellectual disabilities across their entire lifespan in the past 69 years, helping and enhancing the quality of life of over 3,000 PWIDs annually, and also caring and supporting the families and caregivers of PWIDs. MINDS runs over 30 facilities, services, and programs island-wide. These efforts are supported by MINDS Institute, which specializes in the research and development of holistic and sustainable approaches to nurturing and developing PWIDs. SATA CommHealth is a registered charity in Singapore that started in 1947 and has been in operation for over 70 years now. SATA CommHealth was formed to support the government to contain the tuberculosis outbreak back then. Today, SATA CommHealth operates 6 medical centers across the island. They primarily offer GP services, medical diagnostic imaging services, preventive health screening, vaccinations, statutory health screening, mobile medical services, and telemedicine. As an established medical healthcare provider, SATA CommHealth is focused and committed in helping the vulnerable and seniors within the community. And as a charity, they run Doctor on Wheels program, home care services, day rehab centers, community hubs in Fernville, and health talks for corporate companies to help the underprivileged. Today, we have with us Dr. Bhavani from MINDS. She is a doctor with MINDS and has been helping to diagnose patients with suspected ID, intellectual disability, and autism. She is also frequently approached by various public agencies to help ID and ASD patients. Dr. Bhavani has been instrumental in encouraging specialists in eye care, hearing, and dental services to provide assessments and treatments to MIND clients. Her services has been appreciated by caregivers, patients, and families she served, as well as community at large. Dr. Bhavani is currently working with MINDS to develop a national healthcare framework to help patients with intellectual and developmental disabilities. Today, we also have with us Dr. Karen Nai. Dr. Karen Nai is a resident physician at SATA CommHealth, and she is based in the SATA CommHealth Community Hub at Fernville. Dr. Karen is involved on the Doctors on Wheels programs and in various COVID-19 efforts, including serving in the migrant worker dormitory medical post, as well as mobile and home vaccination teams. She is also interested in chronic disease management, especially that of the elderly, and has obtained graduate diplomas in both family medicine and geriatric medicine. At the end of the webinar, we have allocated a Q&A session for you to voice any queries or concerns you may have. If you have any questions that arise during the session as well, feel free to type it out in the chat below. Without further ado, let me hand it over to Dr. Karen. Dr. Karen, please.
Hi, I'm just going to share my screen. Thank you for the kind introduction. Good morning, everyone. And we're glad that you can join us today. Thank you for taking time off on this beautiful Saturday morning as we share about the flu and pneumococcal vaccinations. Something wrong, sorry. Thank you. Okay. All right. So without much further ado, let's talk about vaccines. Okay. So over the next half an hour or so, I'll take you through a brief introduction on vaccinations, and then share a little bit about influenza and pneumococcal disease and their prevention. I will also touch a bit about its relevance in today's pandemic context and its relevance to intellectual disability. And lastly, I'll share on the National Adult Immunization Schedule, or the NAIS. So vaccination has become a very familiar word to us in the last 1 year since the COVID-19 vaccinations were rolled out in Singapore. So much so that when one mentions vaccination, we almost always think of the COVID-19 vaccinations. But there's so much more to it. In fact, vaccines came about more than 200 years ago, back in 1796, when Edward Jenner, who was a British physician and scientist, created the world's first vaccine, the smallpox vaccine. And since 1980, the WHO had declared that smallpox has been eradicated. Along the way, many other vaccines have come along, and the latest being the COVID-19 vaccines. So when we think about vaccinations, we think in broad categories. So we have our childhood vaccinations, which we are familiar with. So taking our children to the GP or the polyclinic for their baby shots, right up to the shots that we get in school, all recorded in our health booklets. Then we have COVID-19 vaccinations, which are well underway now here in Singapore. And most of us would have already received our booster jabs, if not soon, by now. Then we have travel vaccinations as well. So back in pre-COVID days, when travel was much less restricted, we see people coming in for their pre-travel vaccinations, and influenza was one of the most common ones. Then depending on where they were headed to, they would take additional shots. And lastly, we have adult vaccinations, which unfortunately is most overlooked among all the various categories. But thankfully, as awareness is being increasingly raised, more adults are coming forward to protect themselves. These are some of the common vaccine preventable diseases, and a couple of the less common ones are not listed here, things like yellow fever and Japanese encephalitis. But for today, I'll just zoom in on influenza and pneumococcal. So first things first, what is a vaccine? Well, it is a biological preparation, which means it's something derived from a living organism. And in this case, it's from the virus or bacteria that provides active acquired immunity. And this is as compared to natural immunity. So when we are actually infected, so we kena the disease, right? Our body actually mounts an immune response to this infection and builds our immunity. And that in itself is your natural immunity. But in the case of vaccinations, when we receive the vaccine, we also mount that response, and this is termed acquired immunity. And we get this acquired immunity to a particular infectious disease, that of which the vaccine is against. So you might ask, how does this vaccine thing work? How does getting a shot in my arm actually bring about this protection? So vaccines imitate the bacteria or virus by using either mRNA, and now we're probably familiar with that term because our vaccinations for COVID, the Pfizer and the Moderna, are both mRNA vaccines. So either the mRNA or a dead or weakened version of the bug is put into us. And when we receive this vaccination, our body's alarm bells go off. And our immunity then kicks in and trains its army to recognize and fight the enemy, such that when we meet the real thing, our army is really primed and ready to fight. So it's much like our army in Singapore, our NS men and our regulars train so hard every day, so that one day, and hopefully it will never come, but if one day we meet an enemy, they are ready to fight. In the next section, we'll talk a little bit about the flu and pneumococcal disease. So we'll start with influenza. Influenza is caused by influenza virus type A and type B. So the influenza A viruses are divided into subtypes based on the two different proteins on the surface, the H and the N antigens. And based on the different combinations, we have H1N1 or H3N2. The influenza B viruses have two lineages, the B Yamagata and the B Victoria. Its incubation period, which means from the time you are infected to the time you get symptoms, that's about 24 to 72 hours, so about 1 to 3 days. You're infectious from about 1 day before you develop your symptoms, right up to about 5 to 7 days after symptom onset. It's transmitted mainly by respiratory droplets and direct contact with the secretions from our nose and throat. And symptoms-wise, you can get fevers, chills, headaches, body aches, tiredness, and respiratory symptoms such as sore throat, cough, and nasal discharge. When does it occur? Well, in Singapore, it occurs all year round, but with two peaks. So we have the two little flu seasons, your December to February peak, and that corresponds with your Northern Hemisphere's winter season, and the May to July peak, which corresponds with your Southern Hemisphere's winter season. Well, for most people, the flu is perceived as a mild illness, and true, because most people, they feel sick for a couple of days and then it resolves on its own, you're back to your usual self. But it can actually lead to very serious complications, such as pneumonia, which is lung infection, bronchitis, which is airway inflammation, ear infections, heart complications such as myocarditis, so that's the inflammation of the heart muscles, and meningitis, which is the inflammation of the brain lining. So some stats to share: globally, about 290 to 650,000 deaths every year due to seasonal flus, respiratory diseases alone. And this is estimated by the WHO as of December 2017. Locally in Singapore, we see about 1,500 flu-related hospitalizations and just under 600 flu-related deaths. Pneumococcal. Pneumococcal, on the other hand, instead of it being a virus, it's actually a bacteria. So it's caused by the bacteria Streptococcus pneumoniae. Its incubation period is not well defined because colonization happens before invasive disease. So by colonization, we mean that the bacteria is present on the body surface, like our nose, our mouth, our throat, our airways, without actually causing disease in the person. So the bacteria is just sitting there, minding its own business. And it can be as short as 1 to 3 days of colonization before invasive disease. Its infectious period is presumably as long as that bacteria is carried in the oronasal secretions in asymptomatic individuals. And colonization can be as long as weeks to months. Similarly, it's transmitted by your respiratory droplets and direct contact with your respiratory secretions. And symptoms-wise really depends on the organs that are affected. So often I have my patients coming into my clinic saying, "Doctor, I'm here for the pneumonia jab." And true enough, because for the pneumococcal bacteria, it's one of the most common bacteria that causes community-acquired pneumonia. So it can cause pneumonia, your lung infections. It can also cause otitis media, which is middle ear infections, and sinusitis, which is the infections of the sinus cavities. When it becomes invasive pneumococcal disease, that's when you get your meningitis, your pneumonia with bacteremia, which means lung infection as well as blood infection, or bacteremia alone with blood infection. And for all these, the patients that are aged 65 and above are at higher risk of morbidity and mortality. So they have poorer outcomes and their chances of death from this is much higher than for those who are younger. So some local stats. For the period 2000 to 2008, the mean hospitalization rate for IPD was about 380 cases per year, and a total of 157 deaths from IPD. So the absolute numbers are not all that high, but the severity if one is infected must not be overlooked. In 2018, the cases reported were 130. And this is possibly because more people were getting vaccinated along the way. In Singapore, I believe we had both the PCV13 and the PPSV23 vaccines, so the two different types of pneumococcal vaccines in locally around about 2010, if I'm not wrong. In the US, the CDC estimates that if you get pneumococcal meningitis or pneumococcal bacteremia and you're an adult, you have a 1 in 7 chance of actually dying from it. So numbers are small, but it's very serious. So we should think about prevention. So how do we prevent influenza and pneumococcal disease? Well, we can stop the spread with the 3 C's. So clean, cover, and contain. So wash our hands, or if we don't have water and soap at the moment, use your hand sanitizers, which has become very much a part of our daily lives now. Cover your mouth and nose when you sneeze and cough. Thankfully, now we are all masked up when we go out, but unfortunately, sometimes we still do see people who particularly would lower their mask just to cough and sneeze so that they don't dirty their own mask. So a little bit more education needs to be done. And to contain, so avoid close contact with those who have the flu. And if you are sick, do stay at home so that you don't spread the bugs. And the other big thing that we can do is to vaccinate. When I think of vaccination, I really think of myself in an armor, so that, you know, if I go out to the battlefield, I will not gonna the arrow so easily. It's not 100%, but at least it protects a big portion of it. So who should take the influenza vaccine? Really, it's recommended for anyone that's above 6 months old. But there are target groups, and I'll just focus on mainly the adult groups because for today's talk, it's mainly on the adult vaccinations. So persons above 65 years old, those with chronic lung or heart disease, so things like asthma, COPD, congenital heart disease, ischemic heart disease, those who require medical follow-up for various chronic problems such as diabetes, kidney problems, neurological problems, liver problems, blood problems, or immunosuppression. And that includes people who are immunosuppressed because of medications, things like your chemotherapy, or HIV patients, or other immunodeficiencies which may be congenital. The residents of our nursing homes and chronic care facilities are also part of this target group. Healthcare workers and others who provide care to persons at high risk should also get themselves vaccinated so that we protect not just ourselves, but also the people that we look after. Pregnant women of all 3 trimesters should be vaccinated as well. And household members, so people who live with people in the high-risk groups, should also protect themselves as well as their household. So for the influenza vaccines, they are inactivated vaccines and they come in the trivalent and the quadrivalent versions. So you may have heard of these terms, trivalent and quadrivalent. And what it really means is that the trivalent covers 3 different strains and the quadrivalent 4 different strains. So you have one A strain of H1N1 and one A strain of H3N2, and one of the 2 B viral lineages for the trivalent. And in addition to that, for the quadrivalent, you get the other B strain as well. Well, influenza viruses are very smart things, and they undergo very substantial antigenic drift. So it leads to new strains year to year. And that's why our vaccines are updated prior to each hemisphere's winter season, according to the prevalent influenza strain at that time. And that's why you hear, oh, you know, it's the northern hemisphere jab now, or the southern hemisphere jab. And this is what's behind it. So really every year, a yearly vaccine is recommended. And if there's a very significant strain change between the northern and the southern hemisphere composition, then a repeat vaccination may be recommended. So for pneumococcal disease, who is at risk? The extremes of ages, so those who are more than 65 and those who are less than 5 years old. Again, those with chronic illnesses, so a bit of an overlap with the people who are at risk for influenza. So people with chronic respiratory, heart, renal, liver diseases, and diabetes. Those with cochlear implants and cerebrospinal fluid leaks. Those with spleen problems, so either functional or anatomical spleen problems. And again, those who are immunocompromised due to either medications, HIV, or immunodeficiencies. we have two types of pneumococcal vaccines that are on our schedule. And this is the PCV13, which is a 13-valent conjugate vaccine, and the PPSV23, which is a 23-valent polysaccharide vaccine. So they cover 13 and 23 different serotypes of pneumococcus. So for those who are 65 years old and above, you're recommended to take both. And PCV13 is administered first, followed by the 23 about a year later. For those whose ages fall between 18 and 64, the recommendations are based on the individual's medical history. You may ask, are there side effects? Yes, there are. And the common ones really are the local reactions at your injection site. So where they poke you, you may get a little bit of redness, a little bit of sore arm, a little bit of swelling. You may also experience low-grade fever, and that usually does not cross the 38 mark. You may get some headache, body ache, tiredness, joint pain. Some people may also experience a bit of a swelling of the lymph nodes, gastrointestinal side effects such as diarrhea, nausea, vomiting. But these side effects are usually mild, and they usually go away within about 2 to 3 days on their own. Severe allergic reactions can happen, and they are rare, and they can happen within minutes to few hours after vaccinations. So things like anaphylaxis, so swollen face, eyes, lips, and tongue, difficulty breathing, a whole body rash. Anaphylaxis can happen not just with these vaccinations of flu and pneumococcal, but it can happen with really any of the vaccinations, any of the medications, and for some people, even food and other allergens. So now we'll move on to its relevance during our current pandemic. So you might think, shouldn't we just be focusing on the COVID-19 protection now? Well, three main reasons. Firstly, the risk of co-infections, which means getting the COVID-19 plus a flu or a pneumococcal. So it's like a double whammy to the body. And that can sort of tax our system a lot more than if we just had one of those infections. And so the outcome is worse and the chance of dying becomes higher. In fact, it's estimated that the odds of death is about twice as high from a co-infection of flu and COVID as compared to COVID alone. Secondly, viral infections are known to increase the likelihood of a secondary bacterial infection, and in this context, the pneumococcal infection. And this happens because viral infections can alter our surfaces, which are meant to be our first line defense. So remember the story about the colonization versus the infection. So we have this bacteria that's sitting there minding its own business. But with a viral infection, this skin barrier, this mucous membrane barrier gets compromised, and then it gives that bacteria an edge over you to actually invade and infect you. And lastly, it helps to reduce the overall healthcare burden. So we've heard it again and again recently that our healthcare system is strained because of the COVID cases. And thankfully in Singapore, we are still coping. But in some of the other countries, the healthcare systems are just completely overwhelmed. So we want to keep it coping. And by reducing the cases of severe diseases from flu and pneumococcal, we can help to do that. The relevance to intellectual disability. There are some medical conditions that are more common in persons with intellectual disability. And some of these are epilepsy and cerebral palsy, which are chronic neurological conditions, cardiovascular conditions such as congenital heart problems, diabetes, and also an increased risk of respiratory infections. And this can be contributed by the craniofacial features of Down syndrome, things like the narrowed nasopharynx, your flattened midface, microglossia, also the hypertrophy of your adenotonsils, as well as low muscle tone and gastrointestinal reflux disease. all these can then increase the risk of respiratory infections. So because these can be more common in persons with ID, they put them at a higher risk. So protecting them becomes important as well. The National Adult Immunization Schedule, or the NAIS, was established in November 2017 to provide guidance on vaccinations in persons who are 18 and above. And it covers 11 diseases, so flu and pneumococcal definitely, your human papillomavirus, which predisposes someone to cervical cancer, tetanus, diphtheria, and pertussis, mumps, measles, and rubella, Hep B, as well as chickenpox. And the subsidy framework since November 2020 for NAIS vaccinations at polyclinics and CHAS GP clinics makes sure that all these important vaccinations become very affordable for the people. So for the NAIS recommendations for flu and pneumococcal, if you are 65 years old and above, it is recommended that you get 1 dose of flu shot every year or every season, and 1 dose of PCV 13 and 1 dose of PPSV 23. If you are under 65 and above 18, then it depends on your specific medical conditions and indications. And if you are part of the target population that are in increased risk for severe disease from flu and pneumococcal, then you will also receive the subsidies if you are between 18 to 64. So after all that, in a nutshell, as a summary, flu and pneumococcal are vaccine preventable diseases. And the vaccine's benefit in protecting people really far outweighs the most of the time minor side effects and the potential risks. So do protect yourselves and your loved ones. Speak to your doctor about your vaccinations and protect yourself. And with that, I thank you.
Thank you, Dr. Karen. Let me share my slides. Yeah, so as Dr. Karen was sharing, we have our vaccination program. If you find yourself interested in the vaccination program for the flu and pneumococcal, please indicate your interest by either calling or emailing or even just clicking this link here. So for seniors aged 65 and above who hold the Merdeka card or the Pioneer Generation card, the program will have no out-of-pocket expenses for you. So later on, we will share this slide once again for those who are interested. Yes. So now we'll move on to the Q&A session. So if you have any questions, do let us know. I think in the chat, there is a question from from Ko. Does the pneumococcal vaccines offer lifelong protection?
Okay, so for the pneumococcal vaccinations, if you're above 65 and you've taken both of it, you don't have to repeat any of the vaccinations. So in that sense, yes, it's a lifelong protection. If you are less than 65 and you have taken, for example, the PPSV, for example, if you have diabetes or heart disease and you are 55, or for example, you take the PPSV 23, you will take the PCV 13 again when you turn 65. And after that, another dose of 23 is needed. And then it's considered sort of lifelong protection. Again, we have to remember that vaccinations are not 100%, but this is the current immunization schedule for now.
Okay, thank you, Dr. Karen. So there's another question from Ms. Betty Ho. Must flu and pneumococcal jabs always be done together? Is it right to say these two vaccines are necessary in temperate countries only?
Okay, so for pneumococcal and flu, they do not need to be always done together. They can be done separately, but for convenience, most people do come in and get it together. So they can be done together, but not necessary. They're not just necessary in temperate countries only, because as I shared earlier, the flu season runs round the year in Singapore with the two little peaks. So they are still around in Singapore, the flu virus as well as the pneumococcal bacteria. So it's also still important, even though we are not in a temperate country, to protect ourselves.
Thank you. And there's also one question regarding, will those below 65 get subsidy for the pneumococcal vaccine? And how will those under 65 go about vaccinations?
Okay, so for those under 65 with a medical condition, you can see any of the CHAS GPs or polyclinics. And if you fit into the NAIS criteria, so for example, you have respiratory or heart disease, chronic conditions like that, you would automatically, if you are Singaporean, get the subsidy. You don't have to particularly apply for it. You will actually get the subsidy there.
Okay, and there's also one question from Madam Teresa. After the flu and pneumococcal jab, how long need I wait before I get the booster COVID-19 shot?
Okay, so the current guidelines is to try and have a 2-week gap before and after your COVID-19 shot. So try not to overlap things in that 2-week period before and after. So a little bit of planning would do you some good.
Okay. Keep the questions coming in. Yes, we really appreciate all the questions. There's a new one in. Should adults between 18 to 50 years take the pneumococcal vaccines?
The answer to that is yes, if you are in the high-risk population. So if you remember the slide that I shared on who are the people who are at higher risk of pneumococcal disease, so people with chronic issues such as lung and heart disease, kidney problems, immunosuppression, things like that, they should be taking the pneumococcal vaccines, even though you're not 65 yet.
Does anyone else have any more questions? If you have any questions, you can also unmute yourself or type in the chat. Okay, maybe we will just give a few more moments. Okay, we will move on first. If you have any questions, you can always let us know again. Okay. So now we would like to invite Dr. Bhavani for any sharing or observations for persons with intellectual disability when it comes to vaccination.
Hi, good morning, all of you. It's been an absolute pleasure to see such wonderful participation on Saturday morning. Thank you for giving me this opportunity. I think the vaccination schedule and the implications of the vaccines have been wonderfully covered by Dr. Karen. I'd like to just add a few points to note, not particularly only with the two vaccines that she's spoken about, the pneumococcal and the flu jabs, but the pneumococcal jabs for persons with intellectual disability will follow the same schedule as the adult program. So if you're a diabetic, you have underlying renal disease, if you have chronic asthma and you're being treated for medications, recurrent respiratory infections of any sort for which you're attending to, it is good to consider the pneumococcal and the flu jab, even if you fall below 65, or congenital heart disease and you're on regular follow-up. It's good to initiate the conversation either with your principal doctor. If not, then I think approaching a polyclinic or your CHAS GP just to discuss about the national adult immunization schedule if you belong to the at-risk group. The other vaccines that are worthwhile considering if you haven't had these vaccines in childhood will be the chickenpox vaccine, which basically some of them may not have had, but if you have acquired chickenpox in childhood, then I think there's no major concern. But if you don't have a recall and you don't know if your son or daughter has not had chickenpox, then again, it's worthwhile discussing with your family physician on giving a chickenpox vaccine. So that's something to explore. And the third thing is quite a number of them on routine SATA screening, when they get admitted to daycare centers or other facilities, will have a negative hepatitis B screening, which means you have not protected yourself with hepatitis B, despite having your 3 doses in childhood. So if you have not mounted adequate antibodies, then it is again worthwhile going back to get your booster shots. So, so these are some of the additional vaccines other than what has been discussed. And for ladies and young adults who are less than 27 years, papillomavirus, human papillomavirus vaccine for protection against cervical cancer is something that would be worthwhile considering. So I think these are the other vaccines other than what is being discussed today. Thank you so much. And if there are any questions, I'm quite happy to take.
Okay, thank you so much, Dr. Bhavani, for sharing. Before we move on, we will just have a quick photo taking session. So if you don't mind, could everyone help to turn on your cameras, show all your lovely smiles today after listening for so long. Yeah, so just adjust your hair, check how you look in your camera. Okay, just give a few minutes. I see someone taking a walk in the park and still managed to join us for our talk this morning. Thank you for joining us. Okay, if everyone is ready, then we will take the picture soon.
Ready. I see some of you still switching on your camera. We'll give another few seconds. We have quite a number of participants, so we will do. So you have to hold your smile. We'll do 2 rounds of photo taking. Okay, if you are ready, can you pose to the camera? We'll do photo taking. Okay, ready? 3, 2, 1. And then do another page. Hold your smile. 3, 2, 1. Okay, thank you.
Okay, thank you, Annie. Please don't leave yet. Please don't leave yet. So I will just continue to share. So I just want to share about our Minds Care Circle network. So our Minds Care Circle network is a community of caregivers where we share our relevant updates, resources, and news when it comes to persons with intellectual disabilities and caregiving needs. So perhaps if any of you here today are caregivers or know of any other caregivers who may be interested, please feel free to sign up or to scan and share this Minds Care Circle network with them. And also, so we also have our Healthy Life card that we would like to share. So this Healthy Life card, it provides information that can be used in emergency situations. It contains drug allergy, blood type, and emergency contact numbers. And you can see on the right-hand side, this is how the card looks like, which you can carry around with you. So if you sign up for this card, you can enjoy a 10% discount from certain health screening packages and 5% discount for certain services. For the full list of services or any questions you have, you can find out more at this hotline, 62446688. If not, you can also find out more at this URL here. Yes, and so this is just to have a recap of earlier on the vaccination program we were sharing about. If you are interested, you can take down these details. Maybe you can take a picture of this page for you to reference on later of the vaccination program or you can just reach out and call this number for you to easier registration. And actually, we also have a few more questions that come up in the chat. So maybe we can address the few questions again. So one of it is whether hepatitis A vaccination is included in the national vaccination program. It's not included. For those extra questions, for those extra questions, we can just keep on coming in. Yeah, we will stick around to answer the other questions. Sorry, Dr. Karen.
No worries. Okay, so the hepatitis A vaccination is not included in the national program. I think for the national program, really it zooms in on the most important, most basic ones that are of very important outcomes. So for hepatitis A, unfortunately, it's not under the subsidy program, but it can still be offered. And here in SATA, we do carry the hepatitis A vaccine as well. Hepatitis A vaccine also comes in a 2-in-1 version together with the Hep B. So it's called the twin mix. So we do give that here in SATA as well. But unfortunately, for the purposes of National Adult Immunization Schedule, the NAIS, unfortunately, that's not part of it.
Yes, I see that some participants are asking if the slides will be sent. So we will not be sharing the slides, but we will be sharing the recording of the webinar later on. Yeah. Okay. So we will leave this slide over here, your interest for the vaccination program. So it has come to the end of the webinar for today. We would like to thank everyone for taking your time today, whether you're in the park, I see someone in the park, coming in and join us to learn more about vaccines and how it can help you and your loved ones. We hope the information has been useful for you today, be it for your own reference, or also you can share this information with anyone you know, anyone you are close with. Yes. So if not, you can feel free to take your leave for this meeting. Thank you so much for today. Is there anything you would like to add on, Dr. Karen?
Nothing from my side. Thank you everyone for joining us. It's been a pleasure.
Thank you so much.